let's do this, guys. Let's get into some myths versus facts, something that I love doing every week on To Your Health with Dr. G. And for myths versus facts, what I do is I say a statement, and then I have my panelists say myth or fact. We'll kind of do a boom, 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 boom. You'll say myth or fact, gives a few statements why. There are right answers, and there are wrong answers. No, I'm just joking. No. Oh, this is your opinion on getting everything. But no, we try to bring the evidence with you. So, again, we want people to have the right tools, the right information, so they can make the right decisions on what they're doing regarding their health and their well-being. So here we go. Myths versus facts. This is the sports medicine update. Dr. Legaspi, you get the first one, my friend. Here we go. I like this one. Exercise negatively impacts pregnancy.
False.
Please explain.
Very much so. I mean, you know, take one example, gestational diabetes. You know, when you exercise, you increase insulin sensitivity in the body. So for those women who are pregnant, they will actually have decreased risk, or they will mitigate any problems with the gestational diabetes. But overall, they will be very healthier from a cardiovascular standpoint, and it's good to exercise during pregnancy.
Absolutely, thank you. That was definitely a myth. Here we go. Tiffany, here we go. Here's a statement, myth or fact. For recreational runners, running increases the risk of developing knee arthritis, osteoarthritis.
I looked at that one. That's tough for me. So I would think that it is a fact, just because I feel like the more you're doing, yeah, the risk is there. You can still run, but there's different surfaces you can run on. If you're running on a harder surface, you're going to increase your risk of some knee OA. But if you're running in the pool, or you're running on the treadmill, or things like that, the risk is going to not be as high as running outside on the concrete.
You know, when I came with this statement, and it's interesting, I kind of put myself in the gray zone on this one too. When I came with this statement to kind of ask you guys about that, I try to think about the totality of the person. Mm-hmm. You know, what do they do outside of just recreational running on the weekend or something like that? Are they a laborer? Are they work construction for 25 years and get some stuff, you know? And so certainly I'd say if somebody's having knee pain and you're doing things and it's making the knee pain worse, that needs to get looked up. That needs to get worked up by your clinician, by your therapist, by your specialist, because we want people to hopefully not progress to the point where they're needing to take medications or get injections for their knee osteoarthritis from whatever they do. But I always like to take a look at the totality. So I always say, I ask that question, I say, what else does that person do in their life? Anyway, that's me. Here we go, Dr. Legaspi, here we go. Hiring a trainer is enough to hit your performance goals.
Myth.
Please explain.
Yeah, I mean, you know, hiring a trainer will get you somewhere, that's for sure. But you know, if you're not fueling your body for both performance and recovery, then you're really not optimizing where you could be. And so basically what I'm talking about is proper hydration and proper nutrition.
I agree. Thank you very much. I agree. That's definitely, there's so much more involved. The trainer can help. But as you said, there's so much more involved to hitting your performance goals. And I talked a little bit earlier about the importance of sleep. Got to do it. Here we go. Tiffany, here we go. Stretching before exercise will prevent injury. Myth or fact? What's your take on that?
It depends on the type of stretching.
Okay, fair enough. Yeah,
we talked about dynamic stretching versus static stretching. Static stretching, I think you will probably get an injury, or more likely to. Dynamic, I think it's an awesome way to get your body prepped to avoid injury.
And there's no doubt. Thank you very much. Here we go. Dr. Legaspi, it's okay to play through pain.
Myth. I would say myth. I mean, you know, it obviously it depends on the injury, but you know, if you keep going through something, you very well make an injury worse.
Yeah, I agree wholeheartedly. Definitely. Again, I cannot stress the importance of that. If there's pain going on, you know, you've got to talk about that. You know, you should be feeling that. You know, you shouldn't be feeling that as part of your regular exercise. There's got to be something else going on, without a doubt. All right, here we go, Tiffany. I like this. Keep going. Eating just before bedtime makes an athlete fat.
I think that's a myth.
Please explain.
I really think that it's really calories in, calories out. Like if you're, you know, the whole thing with intermittent fasting and such as that nature, like if you just are taking in fuel, it just depends on what you're giving out also at the same time. So it doesn't matter, I don't think, as much the time of day. I know that's the big thing is don't eat after 7 p.m. But if you haven't eaten all day, you need something to refill your body, rehydrate your body, things like that. I don't think that's going to make you fat because you ate after 7.
I agree, and I also tell some of my patients that are very performance minded. I always say, hey, I'm okay with you having a little bit of a protein load a little before you go to bed, especially as you're going to sleep. You're making growth hormone, your restorative hormones that are made out there, reducing your cortisol levels, and also knowing that sleep does help muscle growth. So I'm okay if you just work your body out and you want to have a little protein, get some amino acids in you to help refuel and that's fine. And those people are definitely not fat. All right, so here we go. Dr. Legaspi, I like this. Here we go. Resistance exercise is a far more potent way to increase muscle size and strength than any protein supplement.
True.
All right, excellent. You say fact on that one. Please
Yes.
explain.
Protein supplements will only take you so far. Of course, you have to do some sort of exercise to build your muscles. So
I agree. Excellent. Here we go. Tiffany, I like this one. Taking anti-inflammatories before exercising will lessen the inflammation and pain. What's your take on that one? I have people tell me that all the time. Doc, I'm going to take this Advil before I go out and hit that golf ball around. It's a preemptive strike, so I don't get no pain.
You're setting yourself up to injure yourself. So do not take anti-inflammatory, so you can just try to work through that whatever pain you're having. You need to find out if you're actually having that pain, or if it is an injury or things like that. I wouldn't take something just to try to push through it, because then you are going to hurt yourself.
I also say that sometimes inflammation's not necessarily a negative thing. Say you twist your ankle swells up. You're gonna have inflammation. That's actually a good thing, and the body's gonna respond. Sure. It's gonna start this cascade of events that can help you overcome. And I don't know if I want to have maybe a response of a good inflammatory response be blunted by an anti-inflammatory on board. Right. Here we go. We'll do a couple more of these ones. I like this. All right, Dr. Legaspi, the vegan diet fails to support optimal performance in athletes.
I talked about this a little bit earlier.
Yeah, I was on my crusade a second ago.
Yeah, that would be a myth. You do need to be careful to supplement certain amino acids, because there are some amino acids that are far more prevalent in, let's say, animal meats than they are on a plant-based diet. But it can be done. Excellent. Again, The Game Changer is a great movie, by the way, talking about athletes and what they do on a plant-based approach. Here we go. A couple more of these and then we'll be done. I like this one. Tiffany, here we go. Glucosamine rebuilds damaged knee cartilage. Do we know the evidence on that one?
I can't say that there's enough research out there to show that actually rebuilds it. From experience, patients seem to love it, so it makes them feel better. And whatever makes you feel better, I'm all for. But I don't know if there's enough out there to say that it actually rebuilds the knee cartilage.
What's your take on that one, Dr. Legaspi? Have you seen any data out there?
No, there's there's no evidence to support that it rebuilds cartilage. If anything, it's financial harm. Okay. It's not going to hurt you, but you're paying to take a supplement that doesn't really show any benefit.
All right, I got you on that one. I'm going to do the last myth versus facts myself, because why not participate? I give myself, this is a lob ball for me. This is the easy one, home run. Here we go. Eat healthy, stay active, be smoke-free, limit alcohol, and get adequate sleep to help sustain your physical performance during exercise or sports. That is a fact. Love it. So there you go, myth versus facts, guys. So we got about 5 minutes left.